Here you go.
What you need to know is that 1/3 of black women have traction alopecia, and a lot of it has to do with styling of the hair, pulling the hair, relaxing the hair, doing all sorts of hot combing and things like that. 1/3 of African American women have traction alopecia. So you need to do two things. One is stop with the pulling and all the other things that we got going on. And two is that we've been getting some good results, as you ladies saw, by using the PRP to treat the areas. And what it usually means is that the hair loss hasn't been that long that that the follicles are scarred, that they're still there and that they're dormant, and we're able to get them to grow. Now, this is a fairly new concept because it was always thought that once you get traction alopecia that you really can't get the hair to come back. But we've been able to, with the PRP, get some results that are pretty acceptable and for some people excellent with the PRP.
Okay. And real quickly, what is that exactly that you're holding in your hand?
We have a syringe here, and the syringe has platelets and plasma. Now, the way you get platelets and plasma is you draw blood like if you were going to give a blood test, and then you separate the white cells and the red cells from the platelets, and then you take the platelets and purify them and you inject them.
Perfect. So it's all natural. It's all from your blood, correct?
It's all natural, all from your blood. It's getting your own hair to grow. There's no transplants. There's no surgery involved. You just got to be patient because hair grows about a ½ an inch per month.
Mm-hmm.
But if you're patient, and for most people it's not 100%, but for most people we can get some hair to regrow where it was pretty bald.
Mm-hmm. And so when you get this done, do you need to take any time off of work?
There's no time off from work. Did you take time off of work?
No, I did not.
Okay.
But I know that when most women like me were thinking to do a hair transplant, we knew that it would take time off
There's
of
no
work.
time off from work. There's the time that it takes to come, get the blood drawn, get the treatment done, and then wait for the hair to grow.
Perfect. Asia, did that hurt?
Nope.
And how often should someone see you?
Well, the treatment protocol that I have for this is that you do one treatment a month for 4 months, and then if things are going good, you can go 3 times a year after that.
Perfect. And the way this works, does anyone need insurance to see you? And how much does it usually cost?
Well, it usually costs $400 per session, and insurance doesn't cover it. And we do the treatments once a month, as I said, and then we bring the people back usually 3 or 4 times a year.
Perfect. And it's free consultations.
Yes, the consultations are free because it is important to be able to have the right diagnosis. You don't want to be treating every different type of thing unless you know that you're treating the right diagnosis.
Perfect. And so can you say your name and your location?
Oh, we're in Englewood Cliffs, New Jersey by the GW Bridge. And my name is Dr. Rappaport, Dr. Jeffrey Rappaport.
Awesome. Thank you.
Thank you.
Okay.
Perfect.